In the news more recently, there's been information also not only about, well, there's not as much about sleep in people with Alzheimer's or other dementias, as there is sleep as a risk factor or an association for cognitive impairment as we get older. I wonder if you could talk about that.
A great point, actually. We didn't have a time to go on details, but I want to tell you about what happened to us when we go to sleep. You remember the Randy Gardner, I told you that after some days that he had short-term memory loss after he was not able to sleep. What happened to us if when we actually, during the day, like today, you get all this information from the different lectures and you learn something. You're not going to process anything that you're going to learn today till tomorrow, and I will tell you why. What happened is you're getting all this information tonight. It goes to the center, as you know, we call hippocampal area. Hippocampal area getting all these messages tonight, and they're all built up in there tonight. What happened is that tonight, all these messages that you get today, it needs to go to your long-term memory. It's only happen at night when you sleep. Now, what happened is start to encoding all the information you get during the day. You have a bad day with at your work, your boss, you learn something today, all this stuff goes at night, and you're encoding all of them from hippocampal. You have to empty your hippocampal area in order to be ready for the next day. Now, what a study shows that people don't sleep, they don't have this ability of encoding this information at night when they sleep. That's why that memory doesn't go to the long-term place. Now, in the people, that's why one of the reasons that people have a sleep impairment, because the traffic in the hippocampal area is getting a lot, and they're not able to encoding them and send them to the longer places in the brain. They actually start to have short-term memory loss. And this is one of the things that we always address in the people. They have mild cognitive insufficiency, or they're starting to have some sign of the short-term memory loss. One of the very important questions we should ask about it, that how is your sleep? Because the sleep, I will say, is the most important part of our brain that able to reorganize all the memory messages that we get during the day. And that's what's very, very important for us for knowing that. That's what it's also on the news this day. They're all talking about lack of sleep can increase risk of the memory loss and also dementia. We do not have a specific, like for example, we find a protein or like something like that. We say, okay, everybody has a lack of sleep, they have a risk. Well, we know definitely that lack of sleep can increase risk of memory loss. Absolutely.